Good afternoon, and thank you for joining us today. I am Lindy Ruano, and I am with Eastern Hills of Southern California and the Disability Tribe Initiative. Today's webinar, the COVID-19 vaccine and what it means for the disability community, is offering ASL and Spanish interpretation. For those in need of Spanish interpretation, please click on the white globe at the bottom of the screen labeled Interpretation. Then click Spanish and you will have the choice to mute the original audio. You will then be able to hear Mark Gutierrez provide a live and simultaneous interpretation of the webinar. In the Spanish channel, if you select Mute Original Audio, you will only hear the interpreter. Otherwise, if you don't select Mute Original Audio, you will still be able to hear the English presenters in the background. Our ASL interpreters are Betty McQuena and Destiny Bradford. They have been spotlighted so they can always be seen throughout the presentation. Depending on your device, this may mean that sometimes you cannot see the presenter. We apologize for the inconvenience, but we want to make sure that this live meeting and recording can be accessible to everyone. This presentation will have closed captioning, which you can access by using the button at the bottom of the screen. Next slide, please. A few things to note about Zoom before we get started. This meeting is being recorded to allow us to refer back to the discussion in today's and the input we received today. You can hear and see us, but we cannot hear and see you. Everyone has been automatically put on mute and your camera is not on. Chat is not activated for attendees. However, presenters will be sharing some information through the chat during the webinar. If you would like to ask a question or provide a comment, please use the Q&A feature at the bottom of your screen. We also ask that you indicate at the bottom of your screen who you're referring the question to. We have staff monitoring and responding as necessary. Some questions will be answered in real time. Some will be saved for the live Q&A at the end. Or we may ask for your email address so we can follow up with the more thorough answer after the webinar. For those of you on a phone or a device, you may not be able to use all of the features we discussed. We'll be providing other options for you to access the material or ask questions later in the webinar. Finally, at the end of today's webinar, we'll be asking you to participate in our post-event survey. Once the webinar is over, a new window will pop open with the survey. Please provide your feedback so we can improve on future events. It is now my pleasure to introduce Barry Giardini, Executive Director of the California Disability Services Association. Barry?
Thank you, Lindy, and good afternoon, everyone. It's a pleasure to be with you, and I want to welcome back everyone who's joined us on previous Disability Thrive Initiative webinars, and also welcome those of you who are first-time attendees. The Disability Thrive Initiative is a partnership between California Disability Services Association and Eastern Hills in the service of facilitating meaningful and important alternative services as we work through the pandemic. And today's webinar is a little different. We're not giving necessarily a ton of information or feedback on alternative services, but we are, I think, meeting the topic of the day, which is the COVID-19 vaccine. So today's webinar topic is the COVID-19 vaccine and what it means to the disability community. We've got a great lineup of presenters today. We will have a presentation by Dr. Ron Chapman of CDPH on the science behind the vaccine and how we've gotten just here so quickly as a community. And then we'll have a wonderful panel presentation and question and answer session with Dr. Chapman and others providing various perspectives from the disability community. So I hope that you stick with us and enjoyed today's presentation. But to open us up, we will have an opening by Professor Jerry Collins-Bride. Professor Collins-Bride has over 35 years serving as a primary care provider in general medicine at University of California, San Francisco, with a special focus on adults with developmental and psychiatric disabilities. And I believe Professor Collins-Bride is going to give us a nice opening on today's presentation, and we welcome and thank you for being with us today.
I guess it would be helpful if I put my video on. Thank you so much for that nice introduction, Barry. And I'm really honored to be here with you all today. Normally I would say it's great to see you, but I can't see you, but I can see that there are over 350 participants in the webinar, which is really awesome and a testament to the level of interest and importance of the topic that we're going to talk about today. We know that COVID has really hit people hard, and it's been especially isolating for those with intellectual and developmental disabilities. I have personally seen individuals develop a COVID infection. Some have recovered and some have not, but I've also seen the impact that it's had on providing just routine healthcare, as well as the impact on the ability to have those really important social connections that we all depend upon for a sense of joy in this world. But we now have a vaccine that will change some of this. And today we want to give you some background about the vaccine, how it was developed, how effective it is, how safe it is. And then we're going to focus the rest of our time on the panelists who can talk about how the vaccine specifically has impacted and affected our community here. So please make sure to stick around after for the panel and ask your questions. And thank you once again for being here and being part of this presentation. And I'm done.
Thank you for that, Jerry. And it is now my distinct pleasure to introduce our presenter for the first portion of our presentation today. And it's Dr. Ron Chapman from the California Department of Public Health. Dr. Chapman was the Yolo County Health Officer from 2015 to 2020 and led the COVID-19 response for the first 6 months of the pandemic. Previously, he was the Director and State Health Officer for the California Department of Public Health and led the department to its initial national accreditation in 2014. We are just delighted to have Dr. Chapman here today to present to you all and give you some background on the COVID-19 vaccine. And without further ado, I give you Dr. Ron Chapman.
Thank you so much. And thank you everybody for joining us today. This is a really important and relevant topic, and probably the most important public health measure that we're taking during the pandemic to help us see the light at the end of the tunnel and get out of this challenging and often tragic pandemic that we've been in for over a year. Next slide, please. And next slide. So just to give you a sense of where we are overall, you can find all this information on covid19.ca.gov. We have a public dashboard with daily updated information. You can see on this snapshot from a little over a week ago, the number of cases, over 3.5 million. Unfortunately, number of deaths totaling over 58,000. Lots of tests that have been done during this time, and the percentage of tests that are now positive continue to decline, which is a great sign. That's test positivity. And our vaccine total as of today is over 23 million vaccines administered, with close to 30% of the population in California being fully vaccinated. Next slide, please. This gives you a sense of the impact that COVID-19 infections have had on the people in the United States. It's a reflection as well of here in California. This shows the infection, hospitalization, and death rates by age group. I think what's most astounding is if you look at the bottom category on the left, death, and look across the age groups, you can see how there is just a huge increase once you hit 50, 65 and older. And this has been reflected, unfortunately, in the number of outbreaks that we've seen in nursing homes, and unfortunately, the number of deaths overall. The senior elderly population has been hit really hard. Next slide, please. As well, there are differences based on race and ethnicity with cases, hospitalizations, and deaths. And you can see from this, again, looking at deaths and hospitalizations as well, that Black or African American, Hispanic or Latino significantly increased rates of hospitalizations and deaths. When you combine that with age, it goes, again, even higher. Next slide, please. And this is just a snapshot of the dashboard, again, covid19.ca.gov. You can look up the rates in your counties. You can look up the rates by race, ethnicity, by age, and gender. So this public dashboard has daily updates with great information. Next slide, please. So we have been focusing initially on our vaccination campaign on vaccinating people that are in the high-risk categories that I described. And so really a strong focus in the beginning with folks who are elderly, and a focus on equity. And so this is the Healthy Places Index. We are tracking how we're doing vaccinating people who are in the most poor, underserved areas by zip code in California. Quartile 1 is the most underserved. Quartile 4 are the better served, wealthier communities. And you can see that there's a disparity here. And so we're trying to work really hard in those zip codes, in those communities, to get the resources in there, to get the vaccines in there, to get the important education, information, and messaging to get to the people who need the vaccine most, who have been suffering the greatest burden during the COVID-19 pandemic. Next slide, please. So as you're all probably aware, there are 3 vaccines available in the United States. Pfizer, which is approved for people 16 years and older, and it involves 2 doses given 21 days apart. Moderna, which is approved for people 18 years and older, also involved 2 doses and is given 28 days apart. And the Johnson & Johnson, which is approved for people 18 years and older and involves just 1 dose. You're probably all aware of the news in the last 24 hours that the Johnson & Johnson vaccine is on pause. And I'll talk a little more about that in a couple more slides. Next slide, please. Also want to let you know that Pfizer announced that they have finished their clinical trials in adolescents aged 12 to 15. They have found very, very high vaccine effectiveness and found the vaccine to be safe. So they've actually submitted their clinical trial data to the FDA. That was just done recently. And so we'll be awaiting the emergency use authorization, the approval of the vaccine for adolescents with Pfizer. As well, Moderna has ongoing trials. And I should also mention that Pfizer has an ongoing trial with children, ages 6 months to 11 years old. And Moderna also has trials in adolescents aged 12 to 17. They just completed their recruitment towards the end of February. So we don't have any results yet from the Moderna trial. And they're also conducting trials in children. So, you know, we've been unable to offer vaccines to anybody under 16 years of age, but that will be changing certainly in the next few months. Next slide, please. And you're probably all aware as well that starting tomorrow, all Californians 16 years and older will be eligible for the vaccine. Next slide, please. And next slide. So we've been working really hard to get education information out to people in California to address all of the questions that are coming up. There are a number of ways that we are working hard to ensure the safety of the vaccine. As you know, the FDA has a special advisory group that advises on the safety and effectiveness of the vaccine. It's called the Advisory Committee on Immunization Practices, or ACIP. We developed our own scientific safety review work group here in California to re-review what the FDA ACIP has reviewed. And in setting up that work group, Nevada, Oregon, Washington were so interested, they asked to join us. So we now, and for several months, have had a Western States Scientific Safety Review Work Group. This group's made up of experts from those 4 states in immunizations, public health, academics, and other fields. And I've attended the majority of those meetings where there's been very in-depth discussions about the clinical trial data, the FDA reviews, and all to ensure that the vaccine coming into California is safe and effective. And this group, after all the reviews, determined that the 3 vaccines are safe and effective. Now, as the note says on the bottom here, and this has just been added, the Johnson & Johnson vaccine is temporarily on hold. We have a really strong monitoring system in the United States looking for side effects in vaccines, all vaccines. The system's been around for years. And there were 6 people identified with clots within 14 days of receiving the Johnson & Johnson vaccine. And so the FDA, the US government, decided to put that vaccine on hold. And the Advisory Committee on Immunization Practices met this afternoon, East Coast time. And just before this meeting, I learned that the ACIP is recommending continued investigation and monitoring. And so they will be reconvening over the next 10 to 14 days. And in the meantime, they have advised that we continue to hold on administering the Johnson & Johnson vaccine. I know in the United States, 6.8 million people have received the vaccine, a little over 800,000 in California. And for those folks that are concerned about potential side effects of the Johnson & Johnson, that's totally understandable at this point as we're investigating and looking further into this. The CDC has the Center for Disease Control has some great information for folks who have been vaccinated with the Johnson & Johnson vaccine, basically saying that the signs and symptoms in the few cases, and this is extraordinarily rare side effect of these clots. Again, 6.8 million people received the vaccine and only 6 have been identified with the vaccine side effect of clots. Again, Pfizer and Moderna does not have any of those side effects that have been found in our monitoring system. And so folks that have received the vaccine, if you're more than 3 weeks out from your vaccine, there's no risk of having those clots. If you're within that time frame, they're advising people to contact their doctor if you have a headache, if you have any belly aches, anything that you're concerned about. Again, the advice is to contact your doctor. Next slide, please. And we're happy to answer more questions about the Johnson & Johnson vaccine when the question and answer period comes up. So again, these vaccines are highly effective. Millions of people have received the vaccine. In California, we're doing fantastic with vaccinating folks. And we're seeing the difference with very, very reduced number of cases and hospitalizations. And the vaccine also has been studying some of the variants. These are the viruses that have mutated and changed, the COVID-19 virus that have mutated, and the vaccines remain effective. Next slide, please. So we have some important guiding principles. One is we want to be transparent about all the work we're doing with the vaccine. We're engaging with stakeholders like all of you across California. As I mentioned, we want to make sure that the vaccine is safe, and we want to make sure that there's equitable distribution. Next slide, please. We're engaged in a lot of public education campaigns. We want to correct all the mis and disinformation out there in terms of concerns that the vaccine was created too quickly. These vaccines went through all the steps that any vaccine goes through to be approved. And we want to also help Californians navigate the eligibility process, which again, tomorrow opens up for everybody 16 and older. Next slide, please. We're also working directly with the disability community. The regional centers are making contact with all consumers, and the regional centers and independent living centers are collaborating wherever possible to increase vaccination access. Blue Shield, who's working with the state to create a network of vaccine providers, has worked closely with the county health departments and the regional centers and independent living centers to address the Healthy Places Index vaccination efforts. And as I mentioned, vaccine data is posted daily on our dashboard. Next slide, please. We're creating lots of information with a variety of languages, focus on ethnic and multicultural media. We're working with media outlets in 18 languages all across California, and 337 community-based organizations so far have been funded to help with outreach and messaging. Next slide, please. We're using trusted messengers like all of you through our community-based organizations, our 61 health departments, and a number of local key stakeholders. Next slide, please. And of course, there's myturn.ca.gov, which is where people can go on to get appointments. There's also a hotline with over 250 languages. And the hotline number is 1-833-422-4255. Next slide, please. And we're working really hard to make sure there's multiple access points in your communities to get the vaccine through your local healthcare provider, through pharmacies, through employers, through pop-up clinics and mobile clinics and mass vaccination sites. Hopefully in all of your communities, you're seeing lots of opportunities to get the vaccine. Next slide, please. So I'm going to conclude just by saying I've received the vaccine myself, and I definitely had a sore shoulder. There was about 24 hours where I was feeling a little achy, but that quickly went away. And those are some of the common side effects from the vaccine. Some people feel a little more aches and pains, some feel less. And so I encourage folks to get vaccinated, to get the people you care for vaccinated. And this is the best way we have to get us to the end of this pandemic. So thank you, and I look forward to the questions.
Well, it was around the first of the year when I kind of heard that they were rolling out vaccinations. I was a little bit skeptical at first in regards to how effective they may be and just how they're going to be issued. So it took me a while to kind of do my research and, hearsay from other folks in regards to information about the vaccine, and going to the CDC website continually and talking to folks in the field to see how legit this process was going to be.
I did watch some vlogs, some videos made by healthcare professionals, and some that were opinion-based. I received most of my information through my employer. There was a lot of trainings, a lot of webinars that were provided, a lot of just fact sheets and information. So I think I did like most people and just talk to the people they know. I chose to get vaccinated because I've decided to, I'm no scientist, so I've decided to trust the work that was put into the vaccine and trust that the health professionals have done their best to make it a safe vaccine. So what I do know is the dangers of COVID. And so that's helped to make my decision to get vaccinated. And also in the field that I work in, I do believe it's the right thing to do. And for my own health and my family and all of those good things.
I was a little nervous just because I haven't had all that many shots in my life. And the fact too that the pain level of the injection surprisingly didn't hurt whatsoever. Like I didn't even feel the needle go in or anything. And I also liked the fact that it seemed like everyone was very supportive of one another, like giving out water bottles and snacks if you needed it. Like it was a really cool process, honestly.
I would just say still, and look at all the numbers of people who have taken the vaccine and we're not sick. And now they're telling us that we can merge with other people who has taken the vaccine. So I would look at what's really up front and is showing that it is safe because other people are safe. And I think better this risk than developing COVID and ending up in the hospital and not knowing how the COVID is going to affect you. That's the problem, not knowing how COVID will affect you. Some of us was able to have symptoms and they could fight them at home, but then others had to go directly into the hospital. So I think if you look at that and really look at that seriously, would be the best recourse to go ahead and get the vaccine.
That is great. We're going to introduce our panelists. I'm Will Sanford with the Disability Thrive Initiative, and we're going to go through and talk to a group of folks. So first is Kim Mills. Sorry, Kim.
Hi, so glad to be here. My name is Kim Mills. I am the CEO of A Better Life Together. We provide supports in San Diego. We do supported living, independent living, and day services. I'm also a member of the DDS Vaccine Advisory Committee and on the DS Task Force, and glad to be here.
Great, thanks. And Jesse Rocha from South Central Los Angeles Regional Center.
Hi, good afternoon. My name is Jesse, and I'm the director, Jesse Rocha, and I'm the director for the Consumer and Support Services at the South Central Los Angeles Regional Center. Our particular center, as Dr. Chapman mentioned, we're part of the Healthy Places Index, and we had a large amount of individuals who reside in those particular areas. We serve over 17,600 individuals, and I'm happy to be here to share some of the things we've been doing at our center to help with the vaccination.
Great, thank you. And now Jeanette Underhill from Clausen House.
Good afternoon. My name is Jeanette Underhill, and I am the Executive Director of Clausen House. We provide a variety of programs and services in Alameda County and Contra Costa County to adults with intellectual and developmental disabilities. I'm happy to be here.
Awesome, and we're going to bring back Dr. Chapman from the California Department of Public Health.
Thank you.
And Jerry Collins-Bride, our professor from the UCS School of Nursing. Cool, so this is our panel. So we've been getting Q&A questions come in, and we've got a few things to start with. And so we'll try to go through and just have us move around so different people can, bring in different viewpoints. So for Professor Collins-Bride, we've heard a lot of concerns about how quickly, the available vaccines were developed and approved. Can you explain how scientists made sure the vaccines are safe and what exactly is emergency use authorization?
Okay, so let me try to tackle that. So the vaccine, the way that the vaccines are developed has actually been, that process has been ongoing for the past 10 years. And so it's not a new process, but what I think happened this year, and Dr. Chapman can correct me if I'm speaking out of turn, what happened is that some of the regulations that were roadblocks that took forever to actually get a vaccine to market, those were looked at as not necessary in terms of safety, but were actually perhaps unnecessary. So some of those roadblocks were sort of lifted so that the vaccine production could happen in a much faster way. I know people are concerned that it was developed so quickly, it can't be good, but actually the process of development was many, many, many years. So that's what I think happened. Emergency use authorization, I believe, is when there is a situation like we've had this past year, we've never seen anything like this, that we needed to develop something that would help protect our community from developing disease and dying. So the emergency use authorization came from the federal government to help increase access to vaccines for COVID. Did I hit that okay, Dr. Chapman?
Yes.
Okay.
Good job.
All right.
I think just to emphasize your points, the emergency use authorization got rid of all those bureaucratic barriers that existed for years, which really helped expedite in this extraordinary circumstance of a huge pandemic. And so, yes, you're absolutely right on.
Awesome. So Jesse, one of the things that our community obviously is trying to do is make sure that we do outreach to our very diverse population of folks with intellectual and developmental disabilities. So, what has South Central done to try and help communicate the value and the impact of vaccinations?
Yeah, I think our center initially, when we were given the directive from the department to connect with all of our families, prior to that, we had a lot of families who were contacting the regional center, asking questions and getting assistance. So some of the things we did, well, the first thing we did was we put together a presentation to provide that information to our families. And one of the things we learned is that many of our families were able to absorb the information better when we presented it in the language that they prefer and in their own language. So I think that's very important. It finds that they obtain the information a little more and they kind of understand it much better than just being a basic translation. So we felt that was important. So we went ahead and contacted our parent advisory committee groups. We spoke with them, let them know that the regional center was available to come out to their particular areas and where they have their parent meetings, and the regional center would be happy to provide informational sessions for them. So that's one of the things we did. And one of the other things that came out of that was our center created a vaccination call center where we were able to put together a group of our staff that assisted our families with trying to create some of these appointments and completing those appointments. We did outreach to individuals and their families and continue to answer any questions they had. We responded to some vaccination concerns using that call center. We assisted the securing and actually scheduling those vaccination appointments. We've been able to provide and track some of the data that's out there. So it's been something very important to the regional center. We were able to get out those initial eligibility verification letters that were important when it was first initiated. So those are some of the things we did at our center, and I know many other centers had their own activities.
Awesome. Jeanette, I know one of the things that you did for the community in Oakland was to actually host your own clinic. And so can you sort of talk about how that went and how people felt about that process, and if people had, I'll say, hesitancy, as they came in to that process?
Yes, I'd be glad to. Thank you for that question, Will. We were really afraid in 2020. What we did here at my organization was we decided very early on to channel our fear into becoming more informed to the extent that we could from every layer of my staffing on what exactly is this and how can we prevent it? And if it did encounter us, how can we mitigate it? So we here at our organization spent a great deal of time throughout the whole year of 2020 that we were exposed to real-time information from Alameda County Public Health, the CDC, Community Care Licensing, and our tremendous local regional center of the East Bay. And what we did was I first started to educate the staff, and then we started to robustly educate our clients, particularly our clients that were in residential. And we just took a very targeted approach to making sure that they understood what our organization defined as personal hygiene and environmental hygiene. And both of those were connected to the ability to keep your hands washed, wear a mask, manage your mask, put gloves on, gown up if you needed to. And then also we taught all of our clients about the importance of environmental hygiene, keeping your individual space clean, laundering clothes more frequently. So those are just some examples of very targeted educational things that we did, and it really helped. So when the vaccines came out, we were actually in our organization pretty excited about it. There was very little fear around it. And I think that that was because we spent a great deal of time preparing for it. And that's what I would share.
Thank you, Jeanette. And so, Kim, I know one of the things that has been a concern in the community hesitancy side has really been from the BIPOC community, people of color, and those concerns of history, et cetera. And so how have you thought of and tried to help people sort of get comfortable with or understand how to make that decision?
I think that I like vaccine consideration or contemplation better than hesitancy, because it kind of sends a different meaning to it. So I was talking with some colleagues earlier today about it. It just sounds better because people still are thinking about it. I mean, we have to give people the opportunity and the space to address the concerns that they have. I mean, we can name numerous experiments that have been conducted on communities of color. And people are coming in sometimes with those fears in the back of their head, especially if it's something coming from the government, so to speak. So giving people space to be able to talk about their concerns, and maybe giving them the chance to include other people in their circle of support, their family members, their clergy, people that they trust, would be helpful.
Yeah, it's definitely one of, how do we do it? And we did a webinar a little while ago on informed decision making, and really making sure that people are getting information so they can, for them, make their own personal decisions. So I think it's really important, and I do like that. So for Dr. Chapman, one of the questions that's come up several times in the chat has been, how long do we think the effectiveness of these vaccines is going to be? And I'm pretty sure that's like, we don't know because it's new. But
yeah, that's a great question. And I get that question a lot. So, the way we test one of the ways we test the effectiveness of the vaccine is we can see the body's immune response. We can do a blood test, for example, and check for antibodies for, again, the body's immune response to the vaccine. And we can see how long those last in the blood to prevent severe COVID infections. And so it's clear that the vaccine is going to protect people for months out, probably up to 6 months. But as you suggested, Will, we're still gathering that information. And so we're not exactly sure if it's going to protect you for a year or your lifetime. And then in the meantime, the virus is starting to mutate, to change. And so, honestly, some of these companies are working to modify the vaccine in case people need a booster or we need a vaccine to adjust to the mutations that are occurring. So a lot of this science is evolving.
No, absolutely. So Professor Councilman McBride, one of the questions comes out is sort of from the public health thing of, well, we're wearing masks and we're going through that process. And for those of us who've been around long enough to have gone through the HIV/AIDS early epidemic, and the start of that, we came up with a whole new set of universal precautions. And so is mask wearing potentially something that's going to be, with us even as we get more and more vaccinated for some extended period of time?
So my crystal ball tells me that most likely, yes. I think that we will wearing in the future for a while, maybe a long while. We know that there are countries, especially in the Asian Pacific Rim, where mask wearing is really, really common. And indeed, that's been one of the public health measures to control viruses and infections as they come to be. So personally, I think mask wearing will continue. I do want to make a comment. I've heard from some of my patients about concerns. Well, what if my client or my loved one can't wear a mask? They just can't wear a mask. And I was, and I think that even if somebody has difficulty wearing a mask, that I think that there are some vaccine clinics that can work with that person or that population. So I wouldn't say because you can't wear a mask or you can't wear it effectively, that's a reason you won't be able to get the vaccine. You just might need to go to a clinic that is able to provide that kind of support to someone who has difficulty with a mask.
Absolutely, thanks. So Jeanette, I know that one of the things you mentioned residential is obviously we've had a significant number of folks, direct service professionals supporting people in those homes, and sort of that concern of protection for the staff and others, but also we do have folks that mask wearing is going to be a challenge. I mean, how do you sort of help educate and support people through that process?
I would say accommodation, and we here at my organization strive to meet the clients where they are, because in the end, we want to make sure that we support them to understand at whichever level we need to provide that support of the importance of continued utilization of PPE, whether they're in the community, whether they are at home, whether they are at different programs. And I think meeting the clients where they are is very, very important. It's a by and large a very individualistic task, but one that we find is the most effective, because when you are supporting clients and they get that individualized support, it seems that they retain it better and they can continue to operationalize what we're showing them, which is how to wear their mask. If they can't maneuver, for example, one mask, we get them a bigger size one that will really fit them, and then allow them to work with it until they perfect it. So I would say individualized client training, which is a very time-intensive thing, but certainly worth it.
Well, and again, as we've talked a lot about, person-centered practices and thinking about that, this really is sort of driven that home very directly, because again, we have so many variations. Kim, how is your organization sort of, work through that with folks?
We provide supported living in IL, and a lot of the people that we support, they were already wearing masks, and so we really haven't had challenges with that. People in our day program, because day programs were on pause with the state, they stayed home, and now that we're opening back up, we're doing some people are still afraid to go out because of the virus, and they haven't gotten vaccinated yet. But we're working on it. I mean, I agree with Jeanette. It is person-centered, and so those that maybe might be on the spectrum may have some challenges with wearing their masks, and so if they can't wear it and staff are with them, then staff are surely wearing their masks, and they're providing the safety distance, and we continue to work on that. There's just some people that won't tolerate it, but we won't not support them. We will continue to support them because we're a person-centered agency as well, and we have to meet people where they are.
That's right. And I guess the other question is, in your staffing, what has been sort of your uptake of people getting vaccinated, just in general?
We have a lot of, I think in our industry, a lot of people are people of color that are providing the direct support. Our agency, it's interesting, we had a few people that caught COVID, recovered, and then immediately got vaccinated. We have other people who are just deciding, I'm not quite sure. We're doing a person-centered approach for the people that we support, as well as our employees. And we're giving them the information. We are still going to use all the safety protocols that are in place per CDC guidelines in allowing people to make their decision for themselves, understanding that it's personal. It's personal for the people that we support, and it's personal for our staffing as well. And we want to make sure that we're allowing people to come to their own conclusion and supporting them in whatever way that they need, whether it be time off because they're not feeling well after the second shot. Some people have requested that, and we offer that. We support everyone in our agency to make what the best decision for themselves.
Absolutely, that's great. So Dr. Chapman, I have a couple of questions. I mean, there's obviously, besides the two main ones in Johnson & Johnson, there's other vaccines that are in the pipeline. How do you see those coming online over time? Do those help us out, or are we going to be far enough now we'll stay primarily with the ones that we have in place now?
Yeah, there are a couple of vaccines in the pipeline. AstraZeneca has already been approved in the European Union, but they have not submitted clinical trial data to be evaluated by the FDA in the United States. I think at this point, we're receiving about 1 million first doses per week in California between Pfizer and Moderna. And opening up to all people 16 and older tomorrow, that's an eligible population of 32 million people. So remember, Pfizer and Moderna require 2 doses. So that million, you really have to cut that in half, so to speak. So I think we need more vaccine. And so I think the US government is going to be open to new vaccines as they're submitted, but I'm not sure we're going to get any of those submissions real soon. So we'll see how that goes, but we certainly need more vaccine.
Right. The supply has been one of the ones that people have talked a lot about as far as being the reason that we aren't further along is it's been a supply issue, not a demand side, so to speak. Right. So Jesse, one of the things I know that people often need support with, as you talked a little bit about, was getting hooked up for an online appointment if they don't have the digital technology, but then also getting to and from and actually making those appointments to get the vaccine. So how have regional centers sort of helped in that process to support providers and participants to make that happen?
Well, I think our center in particular looked at the partnerships we created. And I think as Kim and Jeanette were mentioning, we partnered with our vendors, and they were very important with SLS. Were able to actually help schedule the appointments. We provided them the information they needed, and they actually drove them to and from their appointment to make sure it occurred. We also had particular situations where some families wanted to be vaccinated, but they had difficulty going to the site because it wasn't too close to their home. So our center would provide transportation services, not only for the individual we serve, but also for their entire family. So that was very helpful. We had a clinic that we did in March, and we were able to vaccinate over 800 individuals. And one of the things that was great about that was a partnership we did with Kaiser, the city of Los Angeles, and the YMCA. And from there, we learned different ways of running that clinic. And one of the other things we did was we also partnered with our behavioral services, and they were able to be on site at the vaccination sites, and they were able to help and make sure that the administration of the vaccination occurred. And overall, everything went pretty well. I think they only had to intervene maybe 1 or 2 times. They had a conversation. They were able to calm the individual, and the shot was, they were able to administer that. And we also worked and partnered with many of our vaccination sites who also made accommodations for a few people. So those were important for us, and they know the individuals we serve. So they were very supportive. So I think the connection with the partnerships we had and the collaboration we had with those out in the community really made it a successful event for us and make it successful as we continue to move forward.
Awesome, thanks. One question, Jerry, Professor Collins McBride. People are worried about, I might have an allergic reaction to one of the ingredients. So how do people really find out that kind of information if they have allergies that, may be a challenge?
I don't know if there's any particular ingredient that the caution is. Generally the screening for getting the vaccine is if you have a history of just severe allergies overall, sort of broadly, then that gives one pause in terms of whether they should get the vaccine or not. But I don't think there was a specific ingredient that was sort of a red flag about the vaccine. And Dr. Chapman, it looks like you're shaking your head. You agree with that?
Yeah, absolutely. And the concern's more for folks that have the severe anaphylactic reaction, which is, trouble breathing and your throat starts tightening up and all that, which is pretty rare. But people who have that reaction with shellfish or antibiotics or other medications, they just want clinicians to take extra precautions. Like when I got my vaccine, I had to wait 15 minutes and be observed. Folks that have those histories, if it's determined with their clinician to go ahead with the vaccine, they watch them a lot longer. They just take extra precautions.
Yeah.
The other question that came up for Dr. Chapman and Professor Colin Bride would be, you guys speak a language that most of us don't understand because it's mostly medical and it's terminology that's not necessarily easy, and terms get tossed out like efficacy versus effectiveness, and what do those really mean? And so I think that's the challenge for our communities, making sure we're able to provide what we call plain language, but really language that anybody can sort of look at, understand, and say, I get it, or they can at least ask questions about it versus saying, I have no idea what that meant. Any thoughts on how to develop that, or is CDPH going to go into that process to help us a little bit?
Well, I think Professor Collins Bride, as clinicians, I can speak for myself. I try and make it as understandable as possible and not use all the scientific jargon and terminology. I can speak for the California Department of Public Health. When we put out frequently asked questions, we want them really understandable for the public, and it's reviewed by a lot of folks. But I understand what you're saying, Will, and I think there are some communication challenges there.
Yeah, actually, I liked what you just said, Will, which was rather than efficacy, does it work?
Yeah.
Is it safe? How does it work? How will it make me feel? I think it's almost like a good idea to sort of test it with a small group of people to see, do you understand what I'm trying to say here? But it can get challenging because sometimes we, as healthcare professionals, we fall back on some of that jargon. And I think it's great for people to say, whoa, I don't understand what you just said. So, empower people to ask questions and ask them to repeat something, I think is a really good message. Because, as Kim was saying, I think people, all of us, look to people we trust for their advice and for their opinion. And it's very frustrating if somebody speaks in a way that you don't understand. It can be very demoralizing. So we should all speak in a way that we can all understand what the person is trying to say.
Kim, do you have thoughts on, again, how do we, as providers, we're often called on to sort of be that translator, so it's like, how do we get good information to help our folks understand what that really means?
We hosted a call with everyone that we supported and their families, and the staff, just to talk about everything. We keep in touch regularly anyways, but we just wanted to talk specifically regarding the vaccine and who needed support and all of that, and didn't try to sway people either way to get it, but just, what are your concerns? What supports do you need? And so, because they trust me and our staff, we were able just to have the conversation. But I think the more we reach out to individuals who are maybe considering getting the vaccine, using clergy, their faith-based leaders, and also extended family members. In the African American community, auntie could be the one that makes the decisions for the family, or a grandmother, or even someone that may or may not be related to them by blood, but they're just a trusted source. In my family, I have two sisters who are nurses, and so I don't call the doctor first. Sorry, Dr. Chapman, I don't call my doctor first. I call my sisters. Hey, I have this thing. Like, what do you think?
Good idea.
Yeah, because I trust them. And when one of my sisters, she got the vaccine, and I was like, oh, you did. And she works in the hospice field. And so I said, wow, thank you for leading us. Thank you for being the first to lead the way for the family. And because she got it, other people started asking her questions about it. And so that helps as well. Finding out who's important in people's lives, who they trust, and having those conversations with them also, because they're going to have questions. And the more people that are communicated with, the better.
Jeanette, sort of, what are your sort of in that same vein of how do we simplify this for our folks?
I would say, like him, I have one sister who's a registered nurse, and she actually got COVID first, and then she got the vaccine. So I was able to vicariously kind of understand a little bit more without having had COVID, what the manifestations were. With respect to concerns, I think that over the year, when I reflect on what we did here at my organization, we try to communicate with families often and in varied ways. Weekly newsletters, me and my staff made ourselves available for daily phone calls if necessary. But I think really understanding what are the concerns, determining if those are fears or just concerns. And then for us, we started our clinics in January. We were one of the first. And once the staff that were still exploring options of whether they would get it, once they saw that our left arms did not fall off post the COVID injection, if you will, there was a sense of relief. There was a sense of, this is not that bad. I actually guided my staff and clients through how to care for themselves immediately after, in the first 48 hours post their vaccination. They rested, a lot of sore arms and a lot of fatigue. So I think constant communication with the community in varied formats is very important.
Awesome as far as that. So a question Dr. Chapman that came in is from once folks are vaccinated, so you have a group home or a group of folks that are going into the community, is there different protocols related to that? So that, a group of everybody's been vaccinated, the staff has, the individuals going with them. So it's 3 or 4 or 5 folks going into the community. What sort of protocols would you think would, again, sort of be in that frame? Does that change the dynamic, I guess is the question.
The vaccine definitely changed the dynamic. And I look for backup from Professor Collins Bride on this one. We're seeing, as we see fewer and fewer COVID tests that test positive in our communities, and see fewer and fewer people who are sick and hospitalized, we're going to be seeing more and more interactions between people, especially people who are vaccinated. And I think the important point is really, until we get through this pandemic, even the folks who are vaccinated that are beginning to spend more time with other people need to wear a mask. I think that's just one of the important bottom lines. And I know that that's been a challenge during the pandemic for a lot of folks to be masking, but even folks that get vaccinated, myself, I'm vaccinated, when I go to the grocery store, when I go to the gas station, I'm still wearing a mask, and people need to continue to do that.
Yeah, and I'll just put a plug in for hand washing, which, I think actually this pandemic sort of gave us a lesson in some really basic hygiene that we have let go by the wayside, but the importance of hand washing and then taking care of yourself when you're sick and not going to work, not going to school. We're a society that just wants to push through everything. And I think this year has taught us, no, we can't do that. We need to actually stop and have some common sense and actually follow what we're preaching to people.
Try and do that. Yes. Notice those things as far as that. I mean, so right now, Dr. Chapman, we really don't have anything or vaccines for anybody under the age of 16 yet, right? And we really only have one for the 16 to 18-year-olds that's currently available. So again, people are probably obviously concerned as, schools have reopened, et cetera. to the vaccination of, the kids at some point. So I assume that the committee in California is still looking at, as those get approved for emergency use authorizations to come in, that you guys will also review that data and sort of make sure that, yeah, we feel those are safe for our, our youth.
Yes, the Western States Scientific Safety Review Group convenes immediately after the FDA gets any vaccine trial data. They'll do the same for the vaccine information as it comes in on children. And yeah, we're expecting that, in the next month or so for Pfizer, and then soon after for Moderna. And we'll be looking at vaccinating lots of children at that point.
Go through and make those things happen. The other question that came in was, obviously, there was one of the things that came out is the push to vaccinate folks that were at higher risk, and one of those in the IDD community is folks with Down syndrome. What's your take on, is it riskier for folks with Down syndrome to get vaccinated or not? I mean, is there any?
Yeah, I think it's been emphasized really importantly. This is all an important personal decision for the families and the caregivers, and it's a matter of weighing the risks and the benefits. And people with Down syndrome are at much higher risk for suffering from severe illness if they get infected with COVID. So it's highly recommended that people get the vaccine to keep them safe. And I'm sure, I don't know, Professor Collins, Bride, if you have anything to add to that.
No, I would second that. I absolutely have had those conversations, and people are just worried that one of the questions actually that has come up is, well, is that going to alter my genetics? Is that going to alter my genes? And the answer to that is no. But absolutely, people with Down syndrome, I strongly encourage them to get the vaccine. I think the risk is the benefit is much greater than the risk of getting COVID.
Yeah, these are incredibly safe vaccines. And just to amplify your point, I've had the question, do you get COVID from the COVID vaccine? And the answer is absolutely not. There are some of these side effects that I mentioned, feeling achy muscles, sore arm, but that's not the COVID infection. That's your body's immune system responding to the vaccine, which actually is a positive thing, but you cannot get the COVID infection from the vaccine.
Mm-hmm. So one other thing as well is that some people have asked, well, I didn't have a reaction. Does that mean I didn't get any antibodies going? And the answer to that is no. That some people get a reaction, some don't, but that the reaction itself doesn't mean that your antibodies are better than my antibodies.
Yeah, good point.
Yeah.
So yeah, so if it doesn't feel really bad, it's still okay. You're still getting the safety and the protection from it. So we'll do one quick sort of last round robin for all the panelists, for your final thoughts on this as we wrap up on this. Great, it's been very informative to me. I appreciate all your information and perspective. So Jesse, what would you say if someone really needed to get outreach and support? How can they get help from the regional center? What should they do?
I think the important thing to do is just contact your service coordinators, number one. And that's your first point of contact, usually for most centers, but some centers will have emails or phone numbers that you can access through the websites or that they send out to the families to reach. Our particular center, as I mentioned, we have our email and we have a phone number that families can call to provide whatever assistance they need with the vaccination. And I encourage all the individuals that we serve to consider the vaccination because a lot of them do share that they want to go back to their, if you want to call it their normal way of life, seeing their friends and being out in the community, which is important to many of them.
Absolutely, that's great. So Jeanette, as a provider, what would you give advice to other providers who are trying to make sure and educate their staff and the folks they support to really do that in a way that's, both culturally sensitive and information they need?
I would say for providers out there, remain open. This is a once in 100-year event. So many of us on this call will not see the next one, hopefully, unless we just have really good genes. And what that, I believe, translates into is our collective response must be that collective. And the vaccine is the individual's contribution to public health and the collective impact. And I would say for employers and providers, continue to be there for your staff, continue to be non-judgmental and continue to support them, continue to point to successful vaccination examples that they can see up close and personal. With respect to clients and families, again, lots of communication with them in varied methods, and really try to meet your clients where they are. Because as Dr. Bride has said to us, masking is not going to go away. It's here. The elevation of universal precautions now has been operationalized in our individual lives at a very, very intense level. And I think that that's a positive thing, not just in an effort to mitigate COVID as it's had a major impact on our society, but also just to keep ourselves safe and healthy from regular flus and things like that. So that would be my advice to providers and families and clients and staff.
Thanks, Janet. So Kim, same question.
I need to say ditto what Janet said.
No, you don't get to ditto that. You have to come up with a new thing. That's part of the deal.
Give people the space to make the decision that's best for them. And you know, it's almost the trend now is you're an anti-vaxxer or you're you know, vaccine hesitancy, which sometimes could be negative, but it just feels like there's a lot of pressure on people to get the vaccine and not appreciate where people are at based on their experiences, their lived experiences, or the history or their family dynamics. Give people time to figure out what they want to do and what's best for them, and then support them in that. Be it staff working with the clients or clients themselves, just being open to that, knowing that we're still going to need to wear our masks, we're still going to need to be socially distant and all those things, and just make it inclusive. I think the video was great that that was shown a few minutes ago, where the woman said some people are just waiting to see, and then they got it. And so give people a chance to, can I just wait? Is it okay if I just take a moment and just wait and see what's going to happen? So that would be my advice.
But it's staying in that person-centered place the whole time.
Absolutely.
Is really the key for this whole thing. And as a system, sometimes we jump to, we just got to do it. We're going to do it the same way for everybody. When in reality, we're all different people. We all have to make our own decisions. So
I've heard from providers, let's hurry up and just get everybody vaccinated now. And I thought, oh my gosh, do they get a choice? Are we going to make sure that we've done informed decision making, or and it sounds like the person was just exhausted. We're all tired, but let's still make sure our values are still in place, and that we still are person-centered, even in the midst of this pandemic. And I hope that we never see it again, but let's make sure we do this the right way, and support people in making the best decision for their lives.
Absolutely. So Professor Collins-Bride, what are your final thoughts on getting information to folks and just, supporting people as they come and make that decision?
I just want to say ditto to what Kim said, because I really liked what Kim said. No, I think that's right. My own son has vaccine hesitancy, and at first I was really upset about it, and then I had to take a pause and I had to say, I understand your concerns, and I appreciate that, and let's keep talking. So let's just keep talking. If there are people who are still worried, this has been an unbelievable year, and we've all been living with fear and worry and horror, looking at news. So let's just keep talking, keep asking questions, and trying to support one another as we move forward to hopefully a healthier life by the end of this year.
Great, thank you. So Dr. Chapman, I'll give you the final words on this. Any words of advice or places to people if they're do have those questions and are trying to figure out what is the right choice for me or my family member in some cases?
I encourage folks to go to their trusted source of reliable information. I agree with all the panelists. We need to be encouraging and supporting people during this decision-making process. And I just want to emphasize that we are in extraordinary times. These vaccines are extraordinary themselves. They're safe and effective. Early on in the pandemic, you know, I experienced probably the most hopeless and helpless point in my career of 35 years in public health, seeing the incredible number of deaths in our local nursing homes. And now with the staff and residents vaccinated, it's rare to see outbreaks and deaths in nursing homes. So these vaccines, they work. And as a community, we need to support and encourage people, and together we'll get through this.
Absolutely. I would want to express my thank you to the panelists as a whole for all your information and willingness to come up and speak about it. It's a topic that, you know, sometimes brings, you know, hot and cold response to that, is so to say, but I want to thank you for that. And I'm going to bring Barry Giardini back on to wrap us up. There he is.
Hey, thank you, Will. Really appreciate you moderating. And just another thank you to the panelists, Dr. Chapman, Professor Collins-Bride, Kim, Jesse, and Janet. Just so much appreciate your perspective and what you shared today. As Will said, you know, this is it's a topic of, and I think you all spoke to this, it's a topic where we're all growing and learning all the time as this goes on. So thank you for sharing your wisdom and knowledge on this topic. Now I just want to share with everyone on here, want to thank everyone for joining us today, but share just the Disability Thrive Initiative resources that are available to you to continue engaging with us as we work our way through this project. We're going to have a lunch and learn session on Friday from noon to 1 that will really cover some of the topics that we talked about today. It's a conversation, it's live, it's more interactive, and hopefully we'll answer some more questions. If today's presentation stirred up some thoughts that you want to discuss, please join us for the lunch and learn. We'll be happy to continue the conversation there. You can register for that lunch and learn at lunchandlearn.disabilitythriveinitiative.org. We also have a resource library where we will have all the slides from today's presentation up, as well as a recording of the webinar. That's on our website at disabilitythriveinitiative.org. And you can also sign up for our email updates at the website and request technical assistance on alternative services. So that's for providers, family members, whoever might need some support in making sure we're doing meaningful alternative services throughout the system. So please visit the website. There's a ton of resources there that we can utilize to help you. I also want to invite you all to join us for our next webinar in 2 weeks on April 28th. It's on understanding unconscious bias and embracing cultural diversity in the scope of alternative services. We're really excited about that one, and hopefully you'll be there to join us and learn from our presenters as well. And again, just a thank you for being here, for supporting the Thrive Initiative, and know that we are here to support the broad IDD community and look forward to engaging with you soon. Thank you all so much, and we will talk to you soon.